Is the internet good or bad for young people's mental health? Well, this is the sort of thing that people have pretty strong opinions about. Some people would argue that it's negative, others disagree, say it's neutral, even positive. Well, a new paper based on the rollout of broadband in Italy reaches some pretty alarming conclusions. Hello, Diana.
Hi, Tim.
Now, Diana, there is a lot of speculation, isn't there, that the internet may be bad for young people's mental health. What sort of problems are we talking about here? What might it cause? What might it make worse?
So there's a couple of reasons why the internet may be bad for young people's mental health. For instance, if you spend a lot of time on the internet, that may be crowding out beneficial activities such as spending face-to-face time with your family and friends, or engaging in physical activity, and it can also worsen your sleep quality. And secondly, what has been argued a lot, especially in the media, is that if you're especially using social media a lot, you may be engaging in a lot of social comparisons, which could make you feel a bit inadequate and can lower your self-esteem, because you're constantly kind of exposed to these super curated profiles that make you look like, oh, they're living their best lives, and I'm not. And another reason why it could be bad is that this is also true for all of us, not only young people in particular, which is that we are much more exposed to addictive content and addictive devices. So we may be spending much more time on the internet than would be optimal for us, because we're having a little bit of self-control issues and we're more following in a habit than a conscious choice.
I would have thought beyond the anecdotal, it must be pretty hard to create this link from internet to mental health. What sort of research do we have about it so far? How reliable is it?
So the initial evidence that was gathered was based on observational studies and associational studies. So what the researchers done there was they asked people, how much time do you spend on the internet and how is your mental health? And there's a couple of caveats with this approach. First of all, it's really hard to really uncover a causal link, because it could just be happening that people have poor mental health and therefore spend much more time on the internet. Because being on the internet is a choice of humans. So it's really hard to uncover this causal relationship using associational studies. Another drawback is that self-reported measures for both dependent and independent variable, being internet use and mental health, could suffer from different types of biases in terms of measurement. So maybe people don't feel super comfortable being honest about how much time they spend on the internet and also how well they are in terms of mental health. And the last caveat is that many of these studies are based on very small, non-representative samples, so it's a bit hard to extrapolate from their findings to the general population. But there are a couple of new working papers and some published work that has tackled this first question, which is trying to really uncover a causal relationship between those new papers are on social media use and mental health measures.
Now, you have tried to uncover this causal link as well. What have you done here? How did you manage to get that link from internet usage to mental health in a rigorous way?
So what we need to come up with is some kind of as good as random variation and access to the internet. So we don't want this to be an active choice. We want it basically to be falling from the sky and you're exposed to internet access, yes or no. So what we're using is some types of particularities in the rollout of broadband access in Italy in the early 2000s, which is related to the infrastructure of the voice telecommunication beforehand. So the voice telecommunication infrastructure was put in place many, many decades before the internet was even invented, but it made it much easier and less costly to roll out broadband as well in those municipalities. Meaning, if you are a municipality that is very close to this network, it's less costly and this area will be penetrated earlier in the process than the places that are further away from this network. Not only do we use this closeness to the infrastructure, one advantage of our sample is that we observe these places before and after the internet has arrived. So we can compare them before and after. The closer you are, the further you are away, because people may rightfully be worried that these characteristics of the municipalities closer to this infrastructure may not have to be, looking the same way compared to places that are further away, which could also obviously correlate with mental health measures.
And how did you quantify the effect on mental health?
Yes, so that's, I think, one of the biggest advantage of our study is that we have administrative data on any type of hospital stay in Italy that had a mental health diagnosis. So for this time period, we know for every single patient that was admitted to a hospital, we know the particular mental health diagnosis, such as was this person admitted because of depression, anxiety, or an eating disorder. And we also know some basic demographics, such as the gender of the patient and the birth year.
So these are quite serious effects, aren't they? What relationship did you find? And was it the same for everyone, or was it different for young and old, male and female?
So maybe let me start with the good news first, which is that people who were born before 1984 and including 1984, we don't really uncover any kind of systematic relationship between access to the internet and mental health disorders. We do uncover a positive relationship, meaning increases in mental health disorders for male patients who were born after 1984. They're more likely to be hospitalized due to depression, anxiety, drug abuse or addiction, and personality disorders. For females, the picture is a little different. Again, the effects are only visible for females born after 1984. But here we see increases in eating disorders and sleep disorders, as well as drug abuse, addiction, and personality disorders.
The bad news is pretty bad, isn't it? And I suspect that it might even be worse, because the time that you're talking about was a time before social media was pervasive, before we all used our smartphones all the time to keep checking what's on the internet. Does this mean that the effects are likely to be worse now?
We can really extrapolate from our study to what's happening right now, because there are too many moving factors. So one factor that could be speaking in favor of your thesis is that we now do have some kind of credible evidence that social media may be bad for our mental health. And importantly, maybe, Facebook and Instagram wasn't around, but there were already some types of social media platforms in Italy in this time period. There are a couple of reasons that kind of speak against this being worse now, which is, for instance, if we're looking back at the associational studies, what they actually find is that these associations they found 10 years ago are much smaller nowadays than they were in the early periods of internet penetration. And reasons why this may be happening is that maybe we're now much more aware of these potential downsides of internet use, and maybe we were much better equipped in dealing with these devices in these new platforms and making much more conscious choices of how we spend our time on these devices and on the internet.
We have this evidence now. We might want to do something about it, but what can we do? We can't shut down the internet. We can't stop people using social media. What can we do?
So there are also many, undisputed advantages of the internet, and we're clearly the last people on this planet who would advocate in favor of shutting down the internet or social media. What we think we can take away from this exercise is that being aware and having information about the potential downside, this is what people need to be able to make conscious choices and not just follow habits or do things that might be suboptimal for them. So being aware, there are potential costs that are fairly severe as we are measuring them in terms of mental health hospitalizations. Be aware of this, make a conscious choice. How are you spending your time on the internet and how much time you're spending on the internet. And this is also fairly important for parents whose children may not be internalizing these potential downsides of being on the internet.
Good advice. It's a fascinating piece of research. Diana, thank you very much.
Thank you so much for having me.
Well, this seems like a pretty important piece of research. It's called Lost in the Net, Broadband, Internet and Youth Mental Health. The authors are Dante Donati, Ruben Durante, Francesco Sobrio and Diana Zicirovic. It is discussion paper 17170, the CEPR, and you can download it using the link that's on screen now. Well, thanks for watching. We'll see you soon.